This first case articles on the go feature entitled Top 10 Pediatric Surgery was written by Lindsay Joyce, MSN, RN, CNOR. Pediatric surgery is a specialty that takes care of children from birth to late adolescence. And you don't have to be working at a children's specialty hospital or a big academic facility to take care of a child having surgery either. Pediatric surgeries are performed all over the country in surgery centers and many hospitals, along with those large pediatric and academic facilities, so we all need to be prepared to take care of these special patients. We could never create an all-inclusive list in a single podcast, but today we've got a great top 10 list to get you started. 1. Keep the room warm. Temperature regulation is important in the pediatric group, especially in neonates. They are prone to greater heat loss than adults having surgery due to their larger surface area per kilogram of body weight, having thinner skin and lower body fat content. We know warm patients have better surgical outcomes, so a warm room is essential. 2. Children aren't just little adults. Children's care varies greatly from adult care. Their emotional and mental states are different than an adult, so we need to treat kids like they're kids. The cases also require different instruments than the same adult surgery might. The medications may be different too. The dosing most certainly will be. Peds and adult surgeries are very different, so we have to take everything into consideration and treat them for what they are: kids. 3. Parents are patients too. Pediatrics is a patient and family-centered care approach. Sure, the parents must consent to tests and treatment of their children since they are minors, but the parents need to be considered as well. It's nerve-wracking as a parent to watch your child go through the angst and pain of a surgical procedure. And parents are just as nervous and scared as their child is. Nurses must give the same compassionate care to the parents as to the child. 4. Medications are weight-based. We all remember learning the milligrams and kilograms math in nursing school in our PEDS course. An accurate weight must be known to the OR team at all times so that proper doses of medications are given. There are many resources available to make sure that you're always giving the correct dose. 5. Child life specialists are your friends. Child life specialists are healthcare professionals who help children and their families during hospitalizations, illness, and injuries. They help support families and help the child cope with what's going on in their life at the moment. They are a great resource to help prepare a child for surgery and make it a less traumatic event. 6. Be aware of malignant hypothermia, MH. MH is a genetic disorder, and patients may not know they're at risk for this condition until they have surgery. Parents may know they have risk of passing it on to their children, but unless they're tested, they may not know if the children are carriers. OR teams must know what to do if an MH crisis occurs and be ready to handle the situation quickly. 7. Padding is important when positioning. Pad everything. Children have thinner, more sensitive skin, and it's easy to get marks on their skin. Marks and indentations can lead to further skin breakdown, and we want to protect their skin, nerves, bones, and tissues as much as we can. 8. Pediatric surgery could mean taking care of the patient before it's even born. Fetal surgery falls under pediatric surgery. Fetal surgery is the specialty of operating on a fetus while still in the womb of the mother. This delicate surgery requires caring for 2 patients at once. 9. Communication and trust are crucial. Parents are scared to put their child into the hands of someone else, even healthcare providers. A qualified, compassionate patient surgical nurse can make a world of difference in a child's and their family's experience with surgery. 10. There are pediatric-specific credentials. Pediatric Advanced Life Support, PALS, Neonatal Resuscitation, NRP, and STABLE, which is a 6-step assessment in the treatment of post-resuscitation, pre-transportation of sick infants. These extra certifications can ensure nurses are up to date on the most evidence-based care for kids. While certainly not all-inclusive, this top 10 list is a great place to start. We've got more to come in our top 10 series, so stay tuned. Lindsay Joyce. As always, thanks for listening to this episode of First Case Articles on the Go.